Hello everyone, today we are going to discuss about popliteal fossa. Popliteal fossa is located behind the knee joint and it has a rhomboid shape. Because of this rhomboid shape, it has a superomedial boundary, superolateral boundary, inferomedial boundary and inferolateral boundary. So we have to know what are the structures that involves in formation of these boundaries. Superomedial boundary, as you can see here, it is formed by semitendinosus muscle and semimembranosus muscle. Here is the semitendinosus, here is the semimembranosus muscle. Superolateral boundary is formed by biceps femoris tendon, long head and short head of those biceps femoris muscle. Then inferomedial boundary is formed by medial head of gastrocnemius and lateral inferolateral boundaries formed by lateral head of gastrocnemius as well as there is a plantaris muscle which forms the inferolateral boundary. Then flow of the popliteal fossa is formed by the popliteal surface of the femur, popliteal surface of the knee joint and popliteal muscle covering upper posterior surface of tibia. Here you can see popliteus muscle which covers the upper posterior surface of the tibia. Posterior surface of the femur, posterior surface of the knee joint and popliteus muscle. These are involved in formation of flow of the popliteal fossa. Then the structures that forms roof of the popliteal fossa are skin, then superficial fascia, then deep fascia as you can see here. In the deep fascia, it is pierced by a small saphenous vein and posterior cutaneous nerve of the thigh. These structures forms the roof of the popliteal fossa. And let's have a look on what are the contents of popliteal fossa. There are popliteal vessels. Here you can see popliteal artery and popliteal vein. And here you can see tibial nerve. Here common peroneal nerve. Common fibular nerve means common peroneal nerve. And sural nerve arising from the common fibular nerve. Here also sural nerve. Here sural communicating nerve. And here the sural nerve arising from the tibial nerve. And also there is posterior cutaneous nerve of the thigh and genicular branch of the obturator nerve. Connective tissues and lymph nodes are also content of this popliteal fossa. Here in the popliteal fossa you can see this popliteal artery is the most deeper one. That means popliteal artery is anterior to popliteal vein and tibial nerve. Here you can see it is more deeper structure. Usually you cannot feel pulse, popliteal pulse in the popliteal fossa. As in femoral triangle, here also lumps can be arised. When there is a lump in the popliteal fossa, we have to suspect several things. If the lump is arise from the skin and soft tissues, it can be sebaceous cyst, lipoma or sarcoma. If the lump arise from the artery, it can be popliteal aneurysm. If the lump arise from the vein, it can be varicosities of small saphenous vein. If it arise from bone, it can be a tumor of the lower end of the femur or upper end of the tibia. If it is arise from the tendons, lump arise from the tendon, it can be bursitis. And also if the lump arise from the whole knee joint, there can be knee joint effusion. So these are the things that we have to suspect if there is a lump in the popliteal fossa. So that's all about popliteal fossa, and thank you for watching.